Today, let's walk through some critical psychiatric nursing concepts, focusing on medication management and safety in mental health care. Understanding how these medications work and recognizing their potential side effects can be the difference between life-threatening complications and effective symptom management. Imagine you're caring for a client diagnosed with paranoid schizophrenia who has just received a prescription for risperidone. They ask you, "What is this medicine supposed to do?" You might be tempted to say it will help them feel more relaxed or sleep better. However, the correct response is that it will help them think more clearly and reduce hallucinations. Risperidone is an atypical antipsychotic that acts on dopamine and serotonin receptors to control delusions and hallucinations. Now, consider you're working in a mental health facility and need to determine which client the provider should see first. You have a client with depression reporting poor appetite, one with schizophrenia experiencing auditory hallucinations, another with bipolar disorder undergoing rapid mood swings, and a client taking clozapine who reports a sore throat and fever. The priority is the client on clozapine with a sore throat and fever, as this could indicate a granulocytosis, a life-threatening condition requiring immediate intervention. Let's move on to lithium, a common treatment for bipolar disorder. When educating a client about lithium toxicity, you should highlight early signs like tremors and muscle weakness. Similarly, when reinforcing discharge teaching, emphasize the importance of maintaining adequate hydration, drinking at least 8 to 12 glasses of water daily to prevent toxicity. Now, imagine a client on disulfiram experiencing severe nausea and vomiting. What's the likely cause? They ingested alcohol. Disulfiram creates an intense, unpleasant reaction when alcohol is consumed, discouraging relapse in clients with alcohol use disorder. And for those prescribed disulfiram, it's crucial to inform them that even small amounts of alcohol, found in foods, mouthwash, or cough syrups, can trigger this reaction. When caring for an older adult prescribed lorazepam, one of the most concerning signs is a respiratory rate of 10 breaths per minute, indicating respiratory depression. This must be reported immediately. Let's discuss dietary restrictions related to psychiatric medications. Clients on MAOIs, such as those treating depression, should avoid tyramine-rich foods, like aged cheese and red wine, to prevent hypertensive crises. Instead, fresh fruits and vegetables are a safe option. Another medication commonly prescribed for schizophrenia is quetiapine, which may cause orthostatic hypotension. Clients should be advised to rise slowly from sitting or lying positions to prevent dizziness and falls. And with first-generation antipsychotics like haloperidol, it's essential to monitor for extrapyramidal symptoms, such as muscle rigidity, tremors, and restlessness, which require prompt medical attention. When educating a client about fluoxetine, an SSRI, it's important to set realistic expectations. Clients should know it may take several weeks to feel the full effects, and they should never abruptly stop the medication. Similarly, clients taking sertraline should be advised that the medication does not provide immediate relief, and any worsening thoughts of self-harm should be reported to their provider. In emergency situations, recognizing life-threatening conditions is critical. If a client on multiple antipsychotics presents with muscle rigidity, hyperpyrexia, and diaphoresis, suspect neuroleptic malignant syndrome, a medical emergency requiring immediate intervention. Another critical topic is medication contraindications. If a client with a current infection is prescribed clozapine, the provider should be notified, as the medication can suppress the immune system, increasing the risk of serious infections. For those taking benzodiazepines like alprazolam, concurrent alcohol use is contraindicated due to the increased risk of severe sedation and respiratory depression. Similarly, clients prescribed bupropion should be screened for a history of seizures, as the medication lowers the seizure threshold. In clients prescribed methylphenidate for ADHD, weight should be monitored weekly, as the medication can suppress appetite and lead to weight loss. Additionally, clients taking venlafaxine should be informed that insomnia is a possible side effect. Now, let's talk about serotonin syndrome, a potentially life-threatening condition. If a client exhibits symptoms, the first priority is to discontinue the serotonin-affecting medication immediately. Supportive measures such as IV fluids and cooling interventions may follow. And finally, if a client on lithium presents with vomiting and diarrhea, This is a red flag for dehydration and potential toxicity. The provider must be notified immediately. Understanding the nuances of psychiatric medications, their side effects, and necessary interventions is crucial in providing safe and effective care. Whether it's recognizing a granulocytosis in a client on clozapine, preventing lithium toxicity through proper hydration, or knowing when to intervene in a benzodiazepine-induced respiratory depression, your knowledge and attentiveness can make a life-saving difference.